Hey everybody, it's Jason Russell, student physical therapist assistant at Jeff State, and today I'm going to be talking about Alzheimer's disease. Throughout the remainder of this video and through this slideshow, I will be referring to Alzheimer's as AD. But first off, what is Alzheimer's? It is the most common form of dementia, where nerve cells in the brain are changed, either broken down or built up, which can cause other areas of the brain to be affected. As we know, when one part of the brain or the neurological system is affected, it kind of affects the body as a whole. AD is also progressive. It affects the patient, the family, and the loved ones who are taken care of or living with the affected patient. Primarily, memory and cognitive functions are the most impaired things taken away from the patient, which can affect their daily living situations if they're still working, and simple tasks that they might not have thought twice about before. And AD is responsible for 60 to 80% of all dementia cases, which is pretty high. So risk factors for AD, the largest one is aging. As we know, there's breakdown of the brain through aging. This one is primarily 65 years and up, but aging, AD is not a normal part of aging, which is good. There are cases of individuals and patients under the age of 65, and those are called early onset Alzheimer's. The second leading risk factor is family history. So if your parents, brothers, or sisters have it, you are more likely to get it. And also, the more individuals in your family that have it, the higher chance you have as well. So that's why a lot of doctors and PTs who are evaling will ask questions such as, does anyone in your family have Alzheimer's or dementia, and even how many? And the lowest risk factors that kind of don't have a lot of research or factual evidence behind them are genetics and some sort of head injury. Other important facts about Alzheimer's, it's the sixth leading cause of death in the United States. The average lifespan of a patient who is diagnosed with AD is between 4 to 8 years, but they can live as long as 20, which is wonderful. And the saddest part about it is, at the moment, there's no cure for Alzheimer's disease, but it is at the forefront of a lot of research right now, not just in physical therapy, but in the medical world. So what is the relevance of AD to PT? Since age is the leading risk factor of it, students, PTAs, PTs will have a lot of patients over the age of 65 who will come in for hip, knee replacements, prehab, and other PT-related incidences. And some of these patients may have dementia and may have Alzheimer's, and it's important for us to know how to approach it, the best way to deal with it, and the best way to mold our treatment sessions for the individual patient. The biggest things to look for are changes in behavior. That's one of the cognitive functions in the behavior and memory. But for behavior, it's irritability, anxiety, and depression. So being aware that a patient can have these symptoms, and then being aware of how not to infuriate the patient or worsen the condition they're already in. And these are called triggering factors. So the triggering factor could be, for some patients, a change in schedule. So if they normally get up every morning and take a walk, if it's a rainy day and they don't get to, they may be more irritable, or they may be more depressed throughout the day. It can be a difficult task. If you're asking them to try to move a box that's too heavy, they may not be able to do it. They may get really frustrated, and it may kind of hurt your whole treatment session. And the third one is denial of the disease. It's not too common, But for patients who will not accept that they have a neurological disease such as AD, it's very frustrating for them when you as a PTA are trying to mold the treatment session for them, and you're talking to them a certain way and treating them a certain way. It may be frustrating to them because they're not really understanding why you're doing it. And you have to be mindful of your actions, your verbal and your nonverbal communication, keeping a calm voice, trying to create a peaceful environment. Loud, stressful, crowded rooms may be a trigger for them, as well as redirecting their attention with that cognitive and memory impairment. They may lose track of the tasks that you ask them to do. You may need to simplify your directions for the task. It's all dependent on the individual patient. As far as medical intervention and medication, there are a few options that you can use, and it kind of depends on if the physician is trying to use medication for the patient's memory or for their behavior. For the memory, as per Harvard Health EDU, there are 4 main drugs prescribed: donepezil, you're gonna have to excuse this, rivastigmine, galantamine, and mimetine. All these will affect chemical messengers in the brain, and for these, as well as the behavioral medications, the physicians will have to constantly change dosages, change how much you take, if they are combining any medication. And it takes a lot of tampering and a lot of time. And then for behaviors, there's a long list, but the groups are antidepressants, anti-anxiety drugs, and antipsychotics. And again, that will depend on the physician, the patient, and the behaviors that they are displaying. And that's all that I have for AD. I hope you guys enjoyed it. If you have any questions, please ask me. I hope you guys have a wonderful day. Please be safe, and maybe I'll see y'all soon.